Welcome to Abiding Hysteria, the monthly podcast where women and gender diverse people tell their healthcare stories. I'm your host, Rachael Woodard. To hear my healthcare story and why I decided to do this podcast, check out our first episode, Bearing My Scars. If you'd like to know about upcoming episodes, updates, and resources from the show, follow us on social media at Abiding Hysteria. If you'd like early access to uncut episodes with great bonus content, become a patron for only $5 a month at patreon.com/abidinghysteria. Today's episode features Amanda Buschelman, whose health story went viral on TikTok. She is here to talk about having her symptoms dismissed by doctors during a critical situation, misdiagnosis causing a cancer scare, and more. And now, dear listeners, please join me and Amanda Buschelman in this episode of Abiding Hysteria. Hi, everybody. I'm so happy to have my guest, Amanda Buschelman, here today. Amanda, would you tell us a little bit about yourself?
Hi, I am 45. Well, almost. I'm not going to add any more age to myself. I am almost 45. I'm a mother of three. Between my husband and I, we have a total of seven. I am a very busy woman. I am a stay-at-home mom, and I have been for about 14 years now.
Wow.
My career before that was a 911 dispatcher at a police department where I met my police officer husband. And my story began.
All right. So can you tell us a little bit about what brought you on the show today, or what made you decide to tell your story?
What made me decide to tell my story is just women everywhere are being gaslit by doctors. And I feel like the word anxiety and you're anxious are getting thrown around, and it's the new way to call women hysterical. And I think it's important for us as women to encourage future generations and each other that we are our own best advocate. And if we don't advocate for ourselves, no one is coming to do it for us.
100%. So how did your story begin?
So, like most women, I was experiencing some right side pain. And like I said, like most women, I ignored it because I was like, it's nothing. It's probably who knows what. I'll be fine. But it became unbearable. At that point, I scheduled a doctor's appointment for the next day, and I went to see my primary care physician. Immediately upon just pressing on my belly, he said, go to the hospital. You have appendicitis. And I thought, I do not have time for this. But off to the hospital I went. And I was miserable by the time I got there, because keep in mind, this had now been almost 24 hours that I had been experiencing this.
Oh my gosh.
So yeah, I was in a lot of pain. And when the doctor came in, he said, okay, we're going to do an ultrasound. We're going to check on your side. We're going to, see what we can see. And when he came back in with the results, he shared with me that I had a cyst on my ovary and that those can be extremely painful. And that's what I was experiencing. And I said, well, that's not what it is. I don't have any ovaries, and I haven't had any for 10 years. I had them surgically removed. And he said, no, I can see it on this scan, your ovary. And he turned the screen around and he pointed at it kind of huffy and angry and said, this is an ovary. This is a cyst. And I said, but it's not. I don't have any ovaries. And at that point, my mother happened to walk in, and I said, Mom, he's trying to tell me I have a cyst on my ovary. She's like, well, that's not possible. At that point, he sent me home saying, well, then it must be diverticulitis. And I thought, well, that's a leap.
Wow.
You just went from confidently telling me I had a cyst on my ovary to now equally confidently telling me I have diverticulitis. But I was miserable. He prescribed some medication. I thought, at least something's going to get better. That was a Friday. By Monday, I was no better. I was miserable. I called my primary care doctor and I said, should this medication that he gave me for diverticulitis be working? And he said, I just looked at what they sent over to me from the hospital. You have appendicitis. Go back. Go back. And I said, oh my goodness. So back to the hospital I went. I saw a different doctor. And the first thing he said was, you have a cyst on your ovary.
Oh my God.
And I said, but I don't. I do not have ovaries, for the love of God. So he looked up my history, which I was confused about why it took that long for that to be something that was done.
Mm-hmm.
He looked up my history to verify I didn't have any ovaries. And I said, I was there the day they took them out. I purposefully went to the hospital to have them removed because I had endometriosis. And the only treatment that treats that 100% is having your ovaries removed in a complete hysterectomy. So he says, oh, well, this is actually a tumor. And I think you need to go see your OBGYN and have this tumor removed. So now I think, oh my God, I've got cancer. Because of course I'm going to go to the worst case scenario.
Right, of course.
At this point. So I left with the diagnosis of a tumor, and I was horribly in pain. I called my OBGYN immediately, and she got me in right away and said, that doesn't look like a tumor to me, but let's do surgery on Wednesday. I'm going to get you in my surgery schedule right away. Let's get this out because this shouldn't be happening. When I woke up from surgery, my husband said, you had appendicitis the whole time.
No kidding.
No kidding. No kidding. And I feel like it's also important to say that when I was looking at my chart later, how you can look at your chart online now,
Mm-hmm.
the original doctor diagnosed me as I was anxious presenting in the hospital. Sir, I was not anxious. I was miserable. I was in pain. I had appendicitis and I was trying not to die.
Yeah.
So the thing that upsets me the most about the anxious part is I was being dismissed.
Mm-hmm.
And not only that, when doctors now go through my chart, it shows that I am an anxious person. So will other doctors now believe me less or attribute what I am saying is my experience as anxiety? I don't know.
Oh, man. I didn't even think of that, but you're absolutely right. I wonder if there's a way, like a process to get stuff like that removed from your chart because of what
It's
went on.
challenging.
Yeah.
It's challenging. I actually have asked to have that removed, and you have to submit all of these different things, and the doctor can say no.
Ugh.
The doctor who writes it in there can say, no, we're going to leave it.
Oh, boy.
Yes.
That's so fun.
It's horrible. And, my husband had a kidney stone.
Mm.
He was miserable.
Oof.
He was writhing in pain.
Mm-hmm.
Not one time was he disbelieved. Not one time was he blown off. And not one time was he listed as anxious.
Oof.
Presenting the same exact way I was.
Oh, man. I'm so sorry that you had to go through all that. I mean, especially the cancer scare in the midst of all that when it was something very serious, but at the same time, you're like, oh my God, it's cancer.
Is this how it ends? Am I dying of cancer and I have all these babies that I need to take care of?
Yeah. Oh, wow.
But the reality is I could have died from appendicitis
from sepsis
and left my children motherless.
Absolutely. Yes. Yeah.
Yes.
I've read other stories of people talking about how they had appendicitis, especially women who had appendicitis who nearly did go into sepsis because they were disbelieved so long that
everything is attributed to our reproduction. Yes. And everything is associated, every pain we feel abdominally, is attributed to our reproduction.
Mm-hmm.
And we are so much more than that.
Oh my gosh, yes. So much more. And it's so funny to me how little research has been done on women's health because we didn't even really start doing medical research on women's bodies until the 80s, 1980s. I hate that I have to specify that now, but 1980s, yeah. But yeah, it's so strange to me that so many people just don't understand that we know our bodies best.
Exactly. I have lived in this body for 45 years. You've known me for 45 seconds.
Yeah.
I know what's going on and I know when something's wrong. And I've heard it said, if a farmer shows up to a hospital, it's serious. And I feel like the same should apply to women. If I show up to the hospital, it's serious because I've got a lot to do.
Mm-hmm.
I have kids that I'm caring for. I have a whole life that I'm responsible for. I don't have time to be sick, let alone be in the hospital.
Right. Exactly. Yeah. I love that that's our response is like, I don't have time for this, but this is really serious.
Exactly.
That
Exactly.
that is such, I'm sure, a shared experience among a lot of women and gender diverse people too. I mean, like, you just don't know what somebody's going through. I mean, I was in the ER fairly recently, and it was when I should have been at work. And I'm like, I have work to do. I don't want to be here right now. And I was at the ER for 7 hours.
Oh my goodness. Oh my goodness.
Yeah. It's just one of those things, being in a rural place, even with 3 hospitals within, fairly easy driving distance. It's still so long to get in to be seen by somebody, let alone being believed when you actually get in there about what's going on.
Exactly. It's the being believed part. I never thought that I was going to have to try to convince a physician that what I was saying was true.
Yeah.
I thought I would explain my situation and then they would help me. Not that I had to, I don't know what the word even is for what you have to do other than to be convincing and to prove that you're ill. And it's gotten to the point now after this situation, I second guess myself. Like, should I even go to the doctor? Are they going to tell me all my test results are fine? Is there even an issue? Is this in my head?
Mm-hmm.
And the answer is no. I know my body.
100%. I gaslight myself constantly about whether I'm in pain for real and need to take pain medication, or if I am dependent on pain medication. And I'm like, no, you haven't taken it in a while. But if you're feeling pain,
Right.
then take it. The normal amount of pain is 0.
Exactly. The normal amount of pain is 0.
That blows my
And
mind.
if I know, because if I'm at a 3, I'm not even going to take an ibuprofen
Mm-hmm.
because I have a high pain tolerance. I'll just take it. I'll just move on. And yet here I am saying I'm at an 8.
Yeah.
And please God, give me something to make this stop.
Yeah. It's
And I'm
incredible.
told it's nothing.
Yeah.
It is. It's tragic. And you wonder how many women, how many people, I guess is better said, how many people have died because of these situations,
Mm-hmm.
because they weren't believed or they feared not being believed.
Yeah. Or they didn't
And they
even
refused medical treatment.
go in because they knew they wouldn't be believed in the first place.
100%. I was interviewed when this went viral, which I was totally not expecting. When this went viral, I was interviewed by a local newscaster, and she was a woman of color. And she explained to me the reason she was so interested in the story was her own mother was a physician.
Oh,
Her
wow.
mother went, yeah, and she went to the emergency room and told the staff, I'm having a heart attack. The doctors didn't believe her. And she said, no, I'm a physician, and I'm telling you, I am having a heart attack.
Oh, my God.
And they sent her home and she died. And what was explained to me by this newscaster was the amount of disparages amongst people of color, let alone women of color,
Mm-hmm.
being believed by medical staff is mind blowing.
Yeah. Yeah. Especially
it's
the
so
pain tolerance thing. It seems like
exactly
from the physicians I've talked to, people of color in general get treated as though their pain is less overall
or non-existent.
Exactly. And so they don't get pain medications nearly as often as white people do, or especially white men, because they're not believed.
How disgusting. And the only experience any of us bring to any conversation is our lived experience.
Mhm.
And we try so hard to educate ourselves on other people's experiences. But I spent all these years on this planet and I had no idea. And I think it is imperative that once we know better, we do better. And we advocate for everyone.
Yeah,
That
absolutely.
everyone deserves medical care. Everyone deserves to be believed. And everyone deserves health. Without our health, we have nothing.
Mm-hmm. Absolutely. That is so true. So speaking of your story going viral, what was it like for your story to go viral on social media?
So if I'm being honest, it was twofold. Part of it was super fun. The other part was a little bit humiliating. And I learned I learned a valuable lesson. Be careful, little children, what you put on the internet.
Oh boy, yeah.
so so I shared my story just to encourage my, 5 followers that they needed to really advocate for themselves. And I woke up to 4 million views.
Wow.
And yes, and it wasn't just shared nationally, it was internationally. I was featured in magazines and news articles and internet articles all over the world. And like Australia did a story on it. And that was incredibly wild for me to know that it had reached so many people. But what was even crazier was the amount of women specifically who commented from different parts of the world with shared experience.
Mm-hmm.
This isn't just us. This isn't just the American health system. This is a gender issue.
Oh, yeah.
And it's worldwide.
Mm-hmm.
And I I went to bed the night that I posted this, just some mom in nowhere, Ohio. And I woke up with the job of being an advocate for women everywhere. And it wasn't what I expected to do. It wasn't something I was striving to do. But I'm here now. And I feel like it's important that if my voice is heard, then I'm going to sing it from the rooftops that women deserve better.
Absolutely. I mean, as I actually said on another interview recently, if not you, then who?
Exactly. And I believe that with my soul. And I have been talking to women everywhere about advocating for yourself and not only doing that, but encouraging future generations that their voice matters and know your body, know your history, and don't allow physicians to tell you what you know not to be true.
I would say the same goes for insurance too.
100%. If we're not going to be pushy for ourselves, who is?
Mm-hmm.
Nobody's coming in to save us. We have to be our own hero.
Ooh.
I won't allow that to happen to myself or my children. Not ever again.
Absolutely. So that being the case with your social media story, how do you feel about so many health stories being shared online these days then?
I think it's fantastic. I think the fact that the veil is being lifted on health is magic. There are so many things I wish I had known about. Just for an example, the aging process and menopause, perimenopause,
Mm-hmm.
all of those things I didn't know because it wasn't talked about. And now all you have to do is get on TikTok or any social media for that matter, and you'll find women telling you what to expect, showing you what normal is. And I've seen some incredible, miraculous stories of people sharing like pictures of their children or a picture of their husband and somebody else seeing it and saying, this is what I noticed. I think you need to call a physician immediately. Or I see this similarity in your experience and mine, and this is what I was diagnosed with. And what that has given all of us is community. And where there is community, there is support. And I think it's really going to continue to blossom and grow and change medical care.
It's really cool. I've experienced that community myself, just dealing with chronic illness, chronic pain, and like non-diagnosed symptoms that I'm finally starting to get some answers for because other people have shared their experience with those symptoms. And I've been able to say, hey, could it be this? Could it be that? It's given me options that I didn't know I had and an understanding of maybe where these symptoms are coming from, which is amazing. So during your story, what did you find most difficult to navigate throughout what was going on with your health, but also the aftermath of going viral and such?
What was difficult to navigate during the situation was how I was supposed to continue providing care for my children while doubled over in pain from appendicitis. And as a matter of fact, I was interviewed by a man who said, I had appendicitis and I passed out from the pain. How did you take it for that long? And I said, I didn't have a choice. My kids still had to go to school. They still had to have dinner. I didn't have a choice.
Mm-hmm.
I didn't get to just pass out. I still have to function. And I feel like for a lot of people, you still have to go to work. Your bills still need paid. So suffering during that is horrible. So I learned a lot as far as how I can depend on family and other people in my realm to support me in future situations. God forbid I ever have anything similar to this. But as far as things to navigate that were difficult after going viral, it wasn't. It wasn't difficult. It was unexpected. It was at times, like I said, embarrassing. As a matter of fact, an Australian news article took a screenshot from my video to use as the picture, and it was the most god awful thing you have ever seen in your life.
No.
The face I was making. Oh, I'm humiliated in an entire continent.
Oh no.
But as far as navigating social media and all of that that's come from it, it's been a blessing that I didn't expect to come. It really has. It's been parts of it are really fun and learning about new things all the time and having people to interact with that, I never would have met otherwise. It's been a really fun experience, but it's also, I feel like, a responsibility at this point for me to stand up for those who don't know how to stand up for themselves.
That is so true. I mean, a lot of the people that I've come across who are also, chronic illness girlies, as we call ourselves sometimes, I have become really good friends because we just have shared experiences that a lot of people who don't go through these things can't relate to. But as my mom put it, actually, she doesn't know a woman walking who hasn't had an experience, not to that degree for sure, but similar to what we've gone through. And it's not surprising, but difficult to face that reality. And I think
It is.
it's especially important that men understand that that is the reality for a good majority of women.
Absolutely. I couldn't agree with you more.
So, what was surprising to you about this journey from there to here?
The amount of women who have shared experience. The thousands, the tens of thousands of people who have reached out to me and explained, this is how I almost died. This is how I lost this part of my body that I didn't have to have, happen. And all of these things that all of these women have in common that are just so tragic and heartbreaking, and more importantly, preventable.
Yes.
And I feel like that part has been just so eye-opening. I really thought my story was going to be this, wild, crazy, singular experience. But what I've learned through social media is I've never had an individual experience in my life. We are all going through it together. But this needs to be something that stops and stops immediately, because women deserve better. People deserve health.
Absolutely. Who do you think was your biggest advocate during this time, and what did they do to support you best?
My mother, 100% my mother. My mother shows up for me in every way possible to show up for me.
Aww.
She not only, I told her, don't meet me at the hospital. COVID was, winding down, but still, I don't get sick. You're older, stay healthy. I can go to the hospital by myself while my husband takes care of the kids. That was not going to happen. Because like I told you, she just showed up and she was like, absolutely not. Are you going through this alone? And not only that, but while I was miserable, she was feeding us and just being my person. So 100% my mother.
That's so awesome. And when you've got, the ride or die like that, it's amazing how they show up for you in those sorts of situations.
And in ways you're not even cognizant that you need.
Oh, for sure.
Like, I thought, I'm a grown woman, I can go to the hospital by myself. But once I started getting that information and that pushback, I got scared because they had started the IV of pain meds. And so the reality is, once I start to get sleepy and a little spacey from the pain meds, who's going to say to these people, that is not what's happening to her? It can't be. Because I wouldn't have been able to say it for myself.
Oh, absolutely. I mean, that's why it's so important that you have somebody by your side when something like that's going on, because you never know at what point you're no longer able to say what you need.
Exactly.
Yeah. My husband has always been a really big advocate for me, and his presence is invaluable with doctors because they tend to listen more when a man's in the room.
You know, you couldn't be more right. When my husband is in the room at any appointment I've ever been in, I do feel like I am listened to more.
Mm.
And that's so gross.
Yeah, it really is.
That is so gross.
So, what is one question that you wish you'd been asked during this?
Do you mean from the physicians
Yeah.
or the whole process? I just wish not necessarily that they would have asked me a question, but if they would have just believed me for what I said when I said I had those parts surgically removed. I wouldn't make that up. It's mind blowing that a person can look at you in the face and say, I don't have ovaries. And you're still going to say and insist, yes, you do. That's what I wish would have been different.
For sure.
I just wish I would have been heard, and I wouldn't have been dismissed as anxious and, just, which is calling me hysterical.
Mm-hmm. Yeah, I love your comparison to that, because that's what this show is all about, really, is the idea of hysteria still being around today after all this time. And it's like, why do we even have this?
We just changed the words.
Yeah. Mm-hmm.
We just changed the words. But the point of it is exactly the same. You're a woman, you're emotional, you are not to be believed.
Yeah.
And that is just absurd.
Yeah. It is ridiculous. And I just want to know, what evidence would it have taken to convince that doctor that you had a full hysterectomy? Like, did you need to bring your parts in a jar in order for him to believe you? Like, it's so silly to me.
It is. And you know what's sad is they had access to the evidence the whole time.
Yeah, exactly.
Because the second doctor looked it up. And there it was. Both ovaries surgically removed.
Goodness.
And I actually had several people comment that said, well, you should have told him you had a double ovarectomy with your hysterectomy. And I said, well, one of us didn't go to medical school. She is me.
Yeah.
And I would think the lay term of me saying I don't have any would have been just enough for them to believe me. I'm sorry I didn't know the exact surgical term for this. I didn't think I had to.
Yeah.
Make it make sense, because it does not.
What is something that you wish you had known before this whole thing began?
I wish I had known that I had the right to be rude.
Mm.
I wish I had known that being rude, quote, unquote, rude, is okay when you're advocating for yourself. You don't have to constantly be polite. You don't have to take at face value with what someone tells you, especially a man. You have the right to stick up for yourself, however that looks. And I think as women, that applies to a lot of life.
Oh, yeah.
When it comes to being told anything, we are conditioned to be polite, to be well-mannered. And there are times where your manners don't apply. And when it comes to your health or your safety, those are the times you be as rude as you need to.
100%. I tend to find that I get shy around doctors, even though I'm a pretty outspoken person. But when somebody asks me for my symptoms, suddenly my brain goes, what's a symptom? Like the Ralphie with the football in a Christmas Story when he's like, what's a football? I'm like, what's a symptom?
Yes, I think I 100% agree with you. I think we get intimidated.
Mm-hmm.
And that intimidation a lot of times causes people to shut down.
Yeah.
And we turn off what we know to be true.
Yeah. And I find myself gaslighting myself too, where I'm like, well, that symptom's not really a big deal, so I'm just not going to list that one. And it's like, no, I mean, every symptom could be a big deal depending on what it is. And you're not the doctor, so it's not your judgment call to say whether a symptom is a serious symptom or not.
100%. But you know what? I think that's what we all do.
Yeah, for sure.
I think we all get so almost ashamed
mm-hmm.
to have a condition. Even though we are seeking care, we're ashamed of weakness
Mm-hmm.
and we're ashamed of every little thing. Is it going to apply? Am I going to look anxious? Is this doctor going to think I'm just some stupid, crazy woman? And so we hide it,
Especially if
which
it's,
prevents the care we need.
yeah, 100%. And if, especially in my experience, at least, something that seems to threaten our view of our own like femininity or masculinity.
Yes.
Like I was talking to a rheumatologist about, the possibility of autoimmune disorders and stuff like that. And I got so embarrassed about how dry my hands are. And she's like, no, that's a symptom. That's not something to be ashamed of, but that's a symptom in the autoimmune, world. And I got so ashamed about it though. I was like, oh no, I haven't, used lotion on my hands in a while. She's like, no, no, no. This is not a normal dryness. This is a symptom dryness. And I was like, that's so weird that I would dismiss it so quickly.
Well, how unfortunate that that's what we have done to ourselves.
Mm-hmm. Absolutely.
That we do that. If I have a skin rash, I actually will blame myself as if it's some sort of like moral flaw that I have or a character flaw that I have this problem with my skin or my health. I should be better, do better, eat better, all of those things.
Mm-hmm.
And I wonder, I'm curious if men do that too. I doubt it. I doubt it.
They just go, oh, it's not a big deal, and then ignore it until
Exactly.
it's an ER visit. Yeah.
100%.
So, what would you say to someone who has gone through something similar to you or is going through the same thing right now?
Keep pushing and don't give up. You know your body better than anybody on the planet knows your body. And if there is something going on, find someone to help you. You just keep pushing until something happens. You don't have to give up because one doctor or 10 doctors tell you there's nothing wrong with you. It isn't in your head. You know your body, and somebody has to be a hero, and it has to be you.
Mm.
You deserve health. Health is wealth. You have nothing on this earth if you don't have your health. It has to be your priority, and you have to be the person who seeks the care that you deserve to have.
That being the case, how do you go about advocating for yourself now after that experience?
I'd love to say that I'm 100% better, but I'm not. I'm still the same girl who brushes off a symptom and says they're going to tell me my blood work came back fine. They're going to tell me it's not really broken. It's probably just a sprain. It's a waste of everybody's time and energy. And I have to abruptly stop that thought process and say, no, not anymore. Not anymore. If I know there's a problem, I'm going to seek care. But it is still that natural reaction for me to brush it off or assume I won't be believed. So what I'm doing now to advocate for myself is changing every day the mindset that I deserve to be cared for and I deserve to be treated like a human being, not a hysterical woman.
Oh, so much. Yes. Yeah. I mean, just having that mantra of I deserve to be believed, heard, and cared for. It's such a hard thing, especially when you're raised as a person who is made to believe that you're the nurturing kind. So
Yes.
you're like, oh, I constantly have to take care of others, but taking care of myself is not a priority.
100%. And in my motherhood, I have obviously that is my job. I have to provide care for all of these people, but I also am trying to change that in my daughters
Mm.
and my son. So they see me provide care for myself. They see me model that. And I think modeling it is so much more important than telling it.
Oh, yeah.
They see me going and speaking up for myself and standing up for myself for what I know is right. And I think the next generation is going to be better off because of that. Because of everything we're doing right now, the generation coming up will be better.
Absolutely. I know we talked about this a little bit, but what changes would you like to see in our healthcare system to make things better?
I'd just like to see patient centered care. I would just like to see patients, especially women, being seen as a whole person, not just as our reproduction. Not every abdominal pain we have is a period cramp. Not every single pain that I've ever had in my life has to do with my uterus or my ovaries. I have all the same body parts, except for my reproduction as a man. And I would like to be taken seriously as a woman. I think we need to stop seeing when women are in pain as them being emotional, because that's not the experience my husband has when he's been in the hospital in pain. He's not considered emotional or overreacting. He's considered in pain. I think that needs to be equal across the board. I think people of color need to be seen as human beings and that their pain be taken seriously as well. It's disgusting to me that physicians, whether it be that they're even aware that they're doing it, treat people differently based on how they present as a white person, a person of color, or male, female, whatever. I think it's important that there's much more training on pain levels when it comes to what a woman can and can't stand. And I think it would be interesting to have some studies to see when a woman says she's at a 2 versus when a man says he's at a 2, what the actual pain level is. I'm curious to see what that would actually look like and what the disparage between the two would be.
Yeah, especially when you see those videos out there that are like putting the period pain simulators on men and women, and you're like, oh, wow, I didn't realize that like our level of pain tolerance is much higher just based on, you know, how we experience periods, because there are women who don't have as intense period pain, but many have very intense period cramps and pain even all over your body from dealing with the hormonal shifts every month or whenever their period happens. And it's amazing to me seeing like these big buff guys who are like, I can take it. And then they get to like a 5 out of 10 on the period pain simulator and they're like, cannot stand it anymore. They have to stop. And I'm like, you just
and
have
they're
no
screaming
idea.
and writhing in pain. Meanwhile, we're at work.
Yep. We're like,
just taking
okay,
it.
now raise kids. Now do a PowerPoint presentation.
Yep.
Or,
and you know, I think that's another thing I'd like to see change now that we're talking about period issues. I'd love to see that when women go to the doctor and say, you know, I'm having this extreme pain, that it is not normal.
yes.
It is not normal to nearly bleed out every time you have a period. And it is not normal to have such debilitating cramps that you're lying on the floor throwing up.
Yeah, absolutely. 100%.
I had no idea that I didn't need to suffer until I was in my 30s. I suffered. And I communicated this with my gynecologist. And it was, well, that's normal. Take an ibuprofen.
Oh,
okay,
man.
but I can't function. I had to function, but it was awful.
Yeah.
And it took one random fertility doctor to say, you have endometriosis. And my life changed forever.
Yeah.
I got the life that I could have had the whole time by one doctor who I had seen one time listening to me.
I really lucked out in that department because when I was 12, before I'd even had my first period, was diagnosed with PCOS, because the reason I hadn't had a period up to that point was because I was riddled with cysts when I was 12.
Oh.
And so the first time I went to a gynecologist, they had to do like the ultrasound thing that breaks up the cysts and stuff. And I was put on birth control at that time because that was the only thing that they had at the time to treat it. And once metformin became kind of more common in the, you know, use of treating PCOS, I got on that too. But I've been taking birth control pretty much continuously since I was 12 years old, just because when I stop, cysts grow almost immediately.
That's horrifying.
Yeah. And there's almost no research on that at all. And so many women have it.
So many women, and so many women go undiagnosed.
Absolutely.
Whether it be a lack of access to healthcare, which is a real problem, or if it's just a lack of diagnosis, you can feel better. When I tell you I got my life back after my hysterectomy, I was a brand new woman.
Wow.
Brand new. And I wish I would have been listened to earlier in life, because I didn't have to suffer the way my mother suffered her whole reproductive years, and her mother before her. All of those things don't have to happen. We deserve to feel good.
Yeah, it's so hard to understand and empathize with something like this unless you've been there. And
Absolutely.
I think it's super important that we not only tell our stories, but also find ways to train people to understand and empathize with the people who are going through these experiences, so that when they come across somebody who is dealing with this stuff, you can have the empathy accessible within yourself. Because when you're working in a healthcare setting, it's really easy to get jaded.
Yeah.
And as a patient, I understand. And as somebody who's worked in the healthcare industry, I understand. I've been there, and you get burned out so easily. But it's still so important to have that compassion and kindness and understanding that you came to that field with to begin with.
Yes. Everybody is somebody's somebody. And I think that's all you need to keep in your mind to keep the passion alive for your field. Everybody is somebody's somebody. And we all matter.
Oh, yeah. There's a great quote from Doctor Who that reminds me of, and that makes me such a nerd. But it was something about 500 years in time and space, and I've never met anyone who doesn't matter.
Yes.
I absolutely love that. That was my quote that was on my board when I was working in healthcare. And I think that really helped me to keep that in perspective and to access that empathy that I needed to have for the people that I was working with at the time. So as we wrap up here, do you have anything that you want to promote or shout out, or anyone that you want to specifically thank?
Well, to thank people, I would have to have a whole other podcast, because I have just the best support system. Obviously, my mom is the most incredible human to ever walk the earth. And one day when I grow up, I want to be just like her.
Aww.
Also, my husband, who is my very best friend in the whole wide world. There is nobody who gets me on my bad days and my good days, and is the most amazing human ever to do this wild life with. And my children, who look at me every day, and sometimes because they're teenagers don't like what they see, and sometimes they do. In the times that they do like me, it's a great time to be here. So I'm very blessed, and I thank my family so much. And to shout out, I will shout out my TikTok, because I'm not embarrassed to shout out my own social media. I'm at Amanda B Man. You can search me up by Amanda Buschelman, or at Amanda B Man on TikTok, and follow me there. And I tell all kinds of ridiculous stories that make no sense, but here we are, just riding this wave of social media.
Oh, absolutely. And it's super fun too to find your community there and just vibe with each other, because it's amazing how much shared experience we have that we don't even begin to understand until we find each other and then go, oh, hey, yeah, I get you. It's so nice.
Exactly. It's so much fun.
Awesome. Well, thank you so much for being here. I really appreciate you coming on the show.
Great. Thank you.
Thanks for listening to Abiding Hysteria. If this conversation has inspired you to tell your healthcare story, please reach out on social media at AbidingHysteria, or email me at abidinghysteria@gmail.com. If you'd like to support our efforts to tell these healthcare stories, become a patron today for only $5 a month. You'll get early access as well as uncut versions of every episode. Our next episode will release on the first Tuesday of next month, so be sure to follow us at Abiding Hysteria to find out when it drops on Spotify, Apple Podcasts, and wherever you listen to podcasts. And don't forget to leave a review so other people can find us as well. Remember, when it comes to your healthcare, you deserve to be heard, understood, and most of all, believed.